Hello guys, I'm already here now at my orthodontist and today is gonna be 8 months. Actually almost 8 months because I started the brace journey, the upper teeth first. Again, if you don't know, I started June 25 and then today is February uh 3, yes, February 3, and of course that's turning 8 months this 25th. Um, as a recap, guys, they started first at the upper. They haven't put the bottom yet because the goal in the upper they have to pull it up. Once they pull it up, and they're gonna put a tab here to pull the teeth up so that they can put a brace at the bottom so they can pull it down. Now, for now, I'm here for a brace adjustment and change wire supposedly again. Now, when I come in, it depends on what the doctor is going to say. If he will say, okay, change wire now, this is the second wire that they replace that they replaced. This is the second wire, 18.25. That's the measurement of the wire, how wide it is. The first one is so thin, the first one. Now, the third one's supposed to be today. But again, it depends because this happened before. The first wire I had when I came for adjustment, he didn't require for the replacement yet. So he replaced the wire to 18.25, this wire, when I came for third visit. Okay, so now let's see. Um, I'm gonna show to you later on the result and probably before and after. But anyway, yeah, there's a big difference already with my teeth, to be honest, in just more than almost 8 months, and I'm enjoying the journey. But I just don't like the idea when they put a new brace or adjustment, it's gonna hard to eat, for a few days. But I'm cool with that. Probably that means you're gonna lose weight. Not really. But anyway, yeah, I'll be back when they're gonna adjust it. Measurement, that's just like this one's like 18.1.
Yes, that one's 1825 heat activated. I'm not sure 100% which one he's going to want to go to.
Oh, okay.
It'll probably be 1925 Mai Tai.
Okay.
It's been really good though. We are also going to be evaluating TADs today. And I can't remember. I know we've talked to you a little bit about those before. But normally he'll place those in, like, as an alternative to doing jaw surgery to try to lift up the side of your bite and stuff like that.
Jaw surgery. Oh, just the thought of it.
I know. But you see how your jaw is like that way still a little bit? So I don't know where he would place the tabs because it would definitely be up to him where he would place them.
Yeah.
But in a few cases of patients we've had, like how this side is down, he would place them somewhere around here. And every appointment we would place something else tied in or use a series or something to lift that side up to correct it.
Okay, so yeah, because I remember when I first came for a consultation, he said your surgery would be the last option if I want my bite more to be pushed back more. That's what he said. Because I asked about it.
Yeah.
Because that's thing in my mind. I don't like it. So he said he's not thinking about it yet, but he said he's focusing on the tag as possible.
Yes.
I hope so. But
And 1825 heat activated.
Okay.
And we are also examining tabs.
Okay. So we're getting about ready to put those in. So let's see which wire we're going with. Bite. And open. And close. Well, I'll tell you what, we've come a long way already.
a lot of difference.
Yeah, it has. It has. So we're going to get to our wire that we should then be able to place your tabs next visit.
Oh, I'm so excited.
Oh boy, I know you are.
I know.
I can tell you are thrilled.
I might come back next year. Just the thought of it makes my heart palpitate.
I promise it's not as bad as you think it is.
You're
Put
right.
those tabs in.
You're right.
I wore one. I had one. Now, I mean, I didn't have braces or anything with it.
Yeah, you
but
just
I mean,
tried it on?
I had it put in there, and it was there for 6 weeks. I mean, not a big deal. It sounds horrible, you know. Oh, you're gonna put this little wire, this little thing in my jaw, but you know. But yes, in order to get those upper teeth moved enough to get to your bottom teeth, we're going to have to get those tabs in there soon. And this wire we should be able to start pulling from. Without even the tabs having to be in there just yet. Made a nice change. Trying to get the cart before the horse. Oh yeah, that's much better. Now we're centered up. Sorry, I know that didn't feel real good. What I'm trying to do is to assess how thick they built that crown out in order to compensate for your bite. Because at some point, I'm probably going to have to reshape that crown a little bit. But not for now.
Usually, how many weeks is the tad, Doc?
In your case, you will probably have that tad in there for close to 6 months.
Okay.
Yeah. It will take a good while to lift, and then even once we get it lifted, we will probably leave it for longer to keep maintaining.
Okay.
While we move the lower teeth out.
Okay, and then you're gonna put first the upper tad, Doc, and then later on put another tad at the bottom?
Yeah. Yeah. So it's sort of the same scenario as the upper. Once we get the freedom to put braces on the bottom, so we'll move the upper teeth up out of the way a little bit. Then we'll get the bottom teeth on, and we'll get them straightening, and then we'll put the tad in, and we'll bring them down.
Okay. No gum surgery? Too early to say.
Yeah, probably a little too early to say.
Okay, I hope not. You don't have to, Doc.
Yeah, I don't do that, so.
No, I don't want.
I'll send you somebody else for that.
No, I don't want.
And we'll start on the right side.
Right side only. Okay.
Yeah. Yeah. Eventually, we may need some on the left, and we definitely will need some on the lower. But looking at your bite, it's so much lower on the right side. I do think the left side needs to go up, but some of that left side is actually improved with the wire itself.
Yeah.
So I want to get the right side caught up with the left, and then if we still need to continue going up, and once it's level, and we need both sides to go up, then we would put it on the upper left.
Yeah.
First things first, we're gonna get it to here, and then if we still need to keep going, we can go both together.
Gotcha.
And then that will clear for then the lower, and we can work to get the lower down. Yeah. In 6 weeks, so a little shorter sequencing, because we have the wire in. It needs to do a little work, but we can start pulling against that wire. It's strong enough to start lifting.
Okay, Doc. So do you know how many hours would that take, all the procedure on the next visit?
45 minutes.
45 minutes. Okay. All right. I just
Less than one.
Okay. Hard. Hard. All right.
Yeah. All we're gonna do is just numb that tissue. And I'll put the tad in. The tad takes about, between the two of them, probably 10 minutes for me to place it.
Yeah.
And then once the tad is in, we will attach a power chain from the tad down to the brace, and it's gonna be lifting.
Is that the one that like a rubber band?
Yeah. Yeah, it'll just go from the brace up to wherever the tad is, and so it'll just stretch and.
Okay. That's.
It'll be lifting.
Right.
Eventually, depending on, those aren't the most efficient things. The little pull does die off over time. Power chains, so sometimes we'll change and use a little spring, and once the spring is active, it pulls for a little longer. The force doesn't die off, but usually initially we'll just put a power chain on there to start the process.
Yeah, just a start.
Yep.
Yeah. Hello guys, I'm back from the adjustment. Okay, so now they changed wire. It's 19.25 right now. Okay, so this is the third wire replacement. Okay, and my fourth visit since since day one of they put my braces. Okay, they're gonna do a TAD the next meeting, and it's gonna be supposedly from 6 weeks today. But I'm gonna go to out of town and gonna go for a cruise, and I don't want to be in pain, or not pain, but for sure uncomfortable, or you don't know how your teeth will adjust during cruise. And of course, that TAD, like a screw here, they're gonna wrap around, like you saw those people who had brace that has a like a rubber band looking. Yeah, and I don't want that all over my mouth during the cruise, because cruise you're gonna dress up, you're gonna and that kind of look very ugly when you take a photos, and you know what I mean. So the TAD, he said, with my case, if you listen to the whole video and conversation with me and my orthodontist, mine will take months. It will stay there because he will start on the right, and then eventually he will add again to the left to pull the teeth together. And then once it's pulled up together, then they were gonna put brace already in the bottom, and then they're gonna also put a TAD as well on the bottom. So it's kind of like really a long process in my situation. And after that, I asked for the jaw surgery, if they still have to do it. I don't want it, okay? And I don't want to. I just don't want it. I don't know. I just the thought of it, and I don't. Ugh, ugh, of course, and that he will have to send me to a surgeon to do that, because they don't do that here. And I don't care if my mouth is not perfect. I don't care, as long as the teeth is straight and that this and that. That's it. Okay. Even the jaw is like TMJ. I really don't care. Anyway, besides that's another money, another payment again. That's too much, and I don't even know if the insurance will cover that, because the the brace insurance doesn't cover. So I have to put it from my own pocket. It's $7,000, 7 grand, right? So that's too much. So he said it's too early to say about the jaw surgery. As of now, he's focusing with the TAD. Besides, TAD helps the teeth pull up, and then probably that will help arrange, with my jaw formations and stuff like that. I hope so, because I don't want to go to the jaw surgery or whatever. I mean, hell, if I'm gonna go for surgical or whatever, I just go ahead, do my rhinoplasty, do my other, cosmetic stuffs instead, not the jaw. So here's the teeth, guys. This is 19.25 wire. So here's all the wires that I had, guys. So this is the first one, the thin one, the very first. The second, 18.25, and this is the 19.25. This is the one that I had today. All right. So if you notice, guys, the thin one is very thin, because they use that first to prepare your teeth, to prepare yourself, to get accustomed, and it doesn't shock your teeth that it's gonna hurt so bad if they put the thickest. And then gradually they added 18.25, and then of course the thickest will be the 19.25 wire, because that wire will help your teeth to pull up. Where you put the TAD, you attach that rubber band thing from the wire to the TAD. Of course, if you notice, 18.25 and 19.25 is not that much look at big difference, but if you stare at it, if you look at it, that 19.25 is looks stronger, much sturdier looking, and much thicker. Yeah. So if you just want to look at it and see how it looks like, and at least you get an idea in case you want to go for braces. Of course, when I did the change wire right now, I didn't have any issue. I don't have pain, especially when they snap the bracket to remove the wire. I don't have pain, and I know other people who have experience with the braces and their journey. They said that it bothers them. They don't like the snap. They don't like that. It hurts. I don't. Again, it varies with the people. I was not stressed today with this one. I mean, the only thing that bothers me really is the jaw surgery. Just the thought of it, I don't want it. But of course, as a patient, I have the right to say yes or no, because in the end of the day, that's my money. But let's see. I don't know if my mind will change later on. I mean, it's still gonna be a long way to go anyway. So my next appointment will be on May. I did that in purpose, even though my ortho said 6 weeks from now, after this change wire. But we're gonna go again. We're gonna go for vacation. We're gonna go to cruise. I don't know. I want to be comfortable with that. With without have to think about cleaning it and stuff like that. So I'll be back on May. So with regards to Tad, I'm kind of worried and scared, but hell, I've done already laser gum surgery, which is way worse and much major than Tad. You just have to put a numbing cream there, or numbing thing for at your tissue there. So, and then they will put the Tad or the like a screw. Compared to the laser gum surgery, that, wow, that's a lot of work, to be honest. So they have to do a deep cleaning and burn whatever the cavities there, and dig in more, and blood everywhere, blah blah blah. So yeah, for me, for sure, that is nothing compared to that. So yes guys, that's my journey and experience today at my orthodontist, and my next update will be May. And wish me luck. And thank you again guys for accompanying me on my braces journey. Well, I'll see you soon. God bless.